Hi everyone. In today's class of anatomy, we'll be discussing one of the important groups of muscles present around the head and neck region called muscles of mastication. Now coming to the introductory part of these muscles of mastication, here onto this picture you can see that these are the different muscles of mastication. What you can see here, the temporalis, the masseter muscle, and here you can see the two pterygoid muscles. So all these together constitute muscles of mastication. So remember, these are the groups of muscles which are located in the head and neck region in relation to the infratemporal fossa. So all these muscles, they combiningly act together onto the mandible at the temporomandibular joint, especially during the process of mastication as well as the process of speech. And the most important thing you have to remember, it is actually supplied by the mandibular nerve. So all these muscles of mastication, they are supplied by the mandibular nerve, which is the third division of trigeminal nerve. And you might know the mandibular nerve is the nerve of first pharyngeal arch. As a result, any structure that are derived from the first arch should be supplied by the mandibular nerve. Hence, embryologically, all the muscles of mastication is developmentally derived from the first pharyngeal arch. Going on to the names of all the muscles of mastication, it mainly includes four different muscles, which are temporalis muscle. As you can see here, this is the temporalis muscle, which is a fan-shaped muscle located in relation to the temporal fossa. Then it is going to extend down into the infratemporal fossa. Then you can also see the masseter muscle here. The masseter is one another muscle of mastication, extending all the way from the zygomatic arch above to the ramus of the mandible below. Then you can also see the two pterygoid muscles. So just have a look at this here. So here you can see these are the two pterygoid muscles. What you can see here is the lateral pterygoid muscle, which extends backwards from the pterygoid plates onto the neck of the mandible, and you can see here this is the medial pterygoid muscle. So these are the other two muscles of mastication. So basically there are four muscles: the temporalis muscle, the masseter muscle, and the two pterygoid muscles. So try to remember the names of all the muscles of mastication and never confuse masseter with the muscles of facial expression, because it is not muscles of facial expression, but it is muscles of mastication. Now, going on to the attachments of all these muscles, both the origin and insertion of all these muscles. First of all, looking at the temporalis. So temporalis is one such muscle which appears like fan-shaped structure. So the temporalis is a fan-shaped muscle which has its origin in a broad area constituting the floor of the temporal fossa as well as the fascia overlying this temporalis muscles called temporalis fascia. So these muscles, they converge as they descend down and they pass through a gap between the zygomatic arch and the side of the skull to get inserted onto the coronoid process of the mandible and the adjoining part of the ramus of the mandible. If you happen to observe the ramus of the mandible, it is going to be presented with the coronoid process here, that is a coronoid process, and this is the condylar process. So these temporalis fibers get inserted to the coronoid process and the adjoining part of the anterior border of the ramus of the mandible. Now going on to the masseter. So the masseter fibers are arranged in three different layers: the superficial fibers, the intermediate fibers, and the deep fibers. So all these three set of fibers has its origin above from the zygomatic arch and the zygomatic process of maxilla. So all these fibers, they extend backwards and downwards and get inserted to the outer surface of the ramus of the mandible. Then going on to the other two muscles, the medial and the lateral pterygoid muscle. So each of these muscles is said to be made up of two different heads. Medial pterygoid has superficial and deep head, whereas the lateral pterygoid has upper and lower head. So one common thing what you can observe about the origin of these two muscles is that there is a common origin from the lateral pterygoid plate in both the lateral and the medial pterygoid muscles. So both these muscle fibers has its origin from the lateral pterygoid plate. For the medial pterygoid, it is from the medial surface. For the lateral pterygoid, it is from the lateral surface. So one thing is common, that is the lateral pterygoid plate. So here the medial pterygoid has two heads, the superficial head and the deep head. The superficial head has its origin from the tuberosity of the maxilla, whereas the deep head has its origin from the medial surface of lateral pterygoid plate. So the medial pterygoid fibers also runs backwards and downwards, similar to the fibers of masseter, but only difference is that it is going to get inserted to the inner surface of the ramus of the mandible. So the medial pterygoid gets inserted onto the inner surface of the ramus of the mandible, whereas the masseter fibers get inserted to the outer surface of ramus of mandible. So in addition to the ramus of the mandible, the medial pterygoid fibers also extends up to the angle of the mandible, where it also gets inserted. So going on to the lateral pterygoid, it has two heads, upper head and the lower head. Upper head has its origin from the infratemporal surface and the infratemporal crust of the sphenoid bone, whereas the lower head, similar to the deep head of the medial pterygoid, it also originates from the lateral pterygoid plate, but from the lateral surface. Now these two fibers, as they extend backwards almost transversely and get inserted to a small depression onto the front of the neck of the mandible. So this is the region where you would find the neck of the mandible, and this is the place where you would find the pterygoid fovea. So where the fibers of lateral pterygoid, both the upper head fibers and the lower head fibers, they get inserted. In addition to getting inserted to the pterygoid fovea, it is continuous with the articular disc of the temporomandibular joint as well as capsule of the temporomandibular joint. So one important thing that you can remember about the lateral pterygoid is that this articular disc, so the articular disc, what you see within the temporomandibular joint, it is considered to be the degenerated tendon of lateral pterygoid muscle. So these things you have to keep in mind. In general, all the four muscles of mastication, directly or indirectly, is inserted to the various parts of the mandible. Now going on to the nerve supply and actions of all these muscles, I have already mentioned all these four muscles are deriving its nerve supply from the mandibular division of trigeminal nerve. And since the mandibular nerve is the nerve of first pharyngeal arch, all these muscles are derived from the mesoderm of first pharyngeal arch. Now, going back to the nerve supply of individual muscles, the temporalis has its nerve supply from the deep temporal nerves, which is a branch of anterior division of mandibular nerve. Masseter has its nerve supply from the masseteric nerve, which is also derived from the anterior division of mandibular nerve. The lateral pterygoid also has its nerve supply from one of the branches from the anterior division of the mandibular nerve, called the pterygoid branch. So common thing about these three muscles, the temporalis muscle, the masseter muscle and the lateral pterygoid, all three of them will receive nerve supply through the branches of anterior division of mandibular nerve, whereas the medial pterygoid is going to receive the nerve supply through a branch derived from the trunk of the mandibular nerve, and the branch is called branch to medial pterygoid. So among the nerve supply, all the muscles receive its nerve supply through branches of anterior division of mandibular nerve, except the medial pterygoid, which is going to receive its nerve supply from a branch derived from the trunk of the mandibular nerve. Now coming to the actions of all these muscles, there is one common action related to the temporalis, the masseter and the medial pterygoid. As you can see, all these muscles will help in elevation of mandible. There is only one muscle among the muscles of mastication which is going to help in depression of mandible, that is lateral pterygoid. So about the other movements, the temporalis helps in retraction, especially the posterior fibers, and also helps in side to side chewing movements. Masseter, the superficial fibers, helps in protrusion and the deep fibers helps in retraction. Now when it comes to the other movements related to the pterygoid muscles, both the medial and the lateral pterygoid, when it contracts simultaneously with the similar muscles of the opposite side. So what I mean to say is, the medial and the lateral pterygoid muscle of right side along with the medial and the lateral pterygoid muscle of the left side, when they contract simultaneously, they bring about protrusion of the mandible. Suppose the two pterygoid muscles of one side contracts alternatively with the two pterygoid muscles of the opposite side. That means medial and the lateral pterygoid muscle contracting once, followed by the contraction of the medial and lateral pterygoid muscle of the opposite side. If the same thing happens one after the other, it is going to help you in side to side chewing movements. So these are some of the actions that are performed by the various muscles of mastication. Now going on to one of the important muscles of mastication, that is the lateral pterygoid muscle. So this lateral pterygoid muscle is considered to be the key muscle of the infratemporal fossa, because the identification of the lateral pterygoid muscle within this infratemporal fossa is a key. Why? To identify other structures in the infratemporal fossa. Now let us see why it is called key muscle. So here onto this picture you can see this is lateral pterygoid muscle, and you can see the lateral pterygoid muscle is related to numerous neurovascular structures. So on identification of lateral pterygoid, you can easily identify the neurovascular structures in the infratemporal fossa. That's the reason why we call this lateral pterygoid muscle as the key muscle of infratemporal fossa. Now speaking about the relations of this infratemporal fossa in relation to your lateral pterygoid muscle, superficially you need to remove certain structures in order to visualize this lateral pterygoid muscle. So what are the structures that you have to remove when you approach the infratemporal fossa from the lateral aspect? The very first thing you're going to see, other than skin, superficial fascia, deep fascia and the parotid gland, when all these things are removed, the very first thing you're going to see is the masseter, which has its insertion to the outer surface of the ramus of the mandible. Now strip off the masseter, you can see the attachment of the masseter to the outer surface of the ramus of the mandible. When you trace the ramus of the mandible above, you can see two processes of the mandible. Anteriorly you see coronoid process and posteriorly you see condylar process, and onto this coronoid process there is insertion of temporalis. Once you reflect the ramus of the mandible along with the muscular attachments, you're going to see the course of the maxillary artery. As you can see here, the maxillary artery is running superficial to the lateral pterygoid muscle. Now the deep relations, that means you need to take out this lateral pterygoid muscle to see what lies deep to it. The main structure being the mandibular nerve along with its branches. Then you can see the course of the chorda tympani nerve, which is going to join the lingual nerve. Then you can see the middle meningeal artery. So that is the middle meningeal artery here onto the picture, which is running deep to the lateral pterygoid muscle. And one of the heads of the medial pterygoid lies deep to the lateral pterygoid. The head is called the deep head of medial pterygoid muscle. Now going on to the other relations of the lateral pterygoid, you can see along the upper border, you can see these are the deep temporal nerves and vessels. Along with that, you also see the mesenteric nerve. So these are the two main structures that are related to the upper border of lateral pterygoid muscle. Along the lower border, you're going to see this is the lingual nerve. Here is the inferior alveolar nerve as well as vessels. Then you can also see the course of the middle meningeal artery, which is running upwards as it passes deep to the lateral pterygoid muscle. In between the two heads, you can actually see the course of the maxillary artery after it passes distal to the lateral pterygoid, and you can see this very thin nerve called the buccal nerve. Remember, buccal nerve you might have heard even in the facial nerve, but here this buccal nerve is derived from anterior division of mandibular nerve. So what you would have seen earlier is the buccal branch of the facial nerve, which is actually motor to the muscles of facial expression. But here this buccal nerve is a branch of anterior division of mandibular nerve, which is passing in between the two heads of lateral pterygoid muscle, and it is mainly a sensory nerve. Now before closing the today's class, we'll try to go through certain MCQs which are commonly asked from this topic. Just have a look at the question. All are muscles of mastication except. So what are the different muscles of mastication? You know, one is temporalis, then masseter, then medial pterygoid and lateral pterygoid muscle. So these are the four main muscles of mastication. So here you see temporalis, you see medial pterygoid, you see lateral pterygoid. But buccinator, it is not muscle of mastication, but instead it is muscle of facial expression. And since it is one of the muscle of facial expression, it is supplied by the branch of 7th cranial nerve. So that should be the answer B. Going on to the next question, the articular disc of the temporomandibular joint is considered to be the morphological remnant of the following structure. I have already mentioned the lateral pterygoid muscle is said to be made up of two heads, the upper head and the lower head. So you have the two heads of lateral pterygoid muscle, the upper head and the lower head, which is actually going to get inserted to the depression onto the anterior aspect of the neck of the mandible, where you would find the pterygoid fovea. And in relation to this temporomandibular joint, what you see here, that is a place where you find the temporomandibular joint, wherein you can see the presence of the articular disc. So this articular disc is considered to be one of the remnants of the tendons of lateral pterygoid muscle. So the answer here should be the lateral pterygoid muscle, which is considered to be giving out the articular disc as a morphological remnant of it. Going on to the next question, the nerve supplied to the muscles of mastication. The nerve supplied to the muscles of mastication. So any nerve supplied to the muscle, the nerve should be a motor nerve. Among these nerves, ophthalmic, maxillary and mandibular, all these are branches of trigeminal nerve, which is 5th cranial nerve. Out of this, ophthalmic is sensory, maxillary is sensory, only mandibular is motor. And definitely facial nerve supplies the muscles of facial expression. So the answer here is, it's a straightforward question. Nerve supplied to the muscles of mastication is derived by the mandibular nerve. So the answer is C. Now going on to the next question. All the following muscles help in the elevation of mandible except. So you should remember, among the 4 muscles of mastication, the temporalis, masseter and the medial pterygoid, all of them is going to help in elevation of mandible. And the only muscle that is going to help in depression of mandible is lateral pterygoid. So this lateral pterygoid muscle, along with the suprahyoid muscles. So suprahyoid muscles in the neck, along with the lateral pterygoid, they help to bring about depression of mandible. So the only muscle which helps in depression of the mandible is lateral pterygoid muscle. So that should be the answer. So the key muscle of the infratemporal fossa, it is a straightforward question. The answer is lateral pterygoid, because the lateral pterygoid muscle is related to numerous structures in the infratemporal fossa. So the identification of the lateral pterygoid helps you to identify all the rest of the structures in the infratemporal fossa. Hence it is considered to be the key muscle of the infratemporal fossa. So if you have to understand what structures are related to this lateral pterygoid muscle, so along the upper border you see the deep temporal nerves and the mesenteric nerve. Along the lower border you see the lingual nerve, inferior alveolar nerve, and there is passage of middle meningeal artery. In between the two heads there is passage of maxillary artery and there is passage of buccal nerve. So these are the different neurovascular structures that are intimately related with the lateral pterygoid muscle. So the identification of lateral pterygoid muscle is very important in identifying rest of the structures. Hence it is considered to be one of the key muscles of infratemporal fossa. So that should be the answer. Answer is B. Going on to the next question. Identify the structure passing between the two heads of lateral pterygoid. Just in the previous slide I had told there are two structures passing between the two heads of lateral pterygoid muscle. One, the buccal nerve, which is a branch of anterior division of mandibular nerve, and the second is the course of the maxillary artery, specifically at the junction between the second and the third part. So these are the two structures that are going to pass in between the two heads of lateral pterygoid muscle. So not deep temporal nerves. Deep temporal nerves come out along the upper border. The lingual nerve and the inferior alveolar nerve comes out along the lower border, and the buccal nerve is the one only coming between the two heads. So the answer is C. So some of the important points that you can remember from today's class on muscles of mastication. Remember, these are the group of muscles seen in relation to infratemporal fossa, and all these muscles, they bring about movements of mandible at the temporomandibular joint, especially during the process of mastication and speech. Common nerve supply, mandibular nerve. Development embryologically, it is derived from the mesoderm of first pharyngeal arch. So what are the names of all the muscles of mastication? Temporalis, masseter, medial pterygoid, lateral pterygoid muscles. When it comes to the attachments, temporalis has its origin from the temporal fossa, gets inserted to coronoid process of ramus of mandible. Whereas masseter has its origin from the zygomatic bone, zygomatic arch and the zygomatic process of the maxilla, and get inserted to the outer surface of ramus of the mandible. Medial pterygoid has two heads, the superficial head and the deep head. The superficial head originates from the tuberosity of the maxilla, and the deep head originates from the medial surface of the lateral pterygoid plate, which is in common with the one of the fibers of lateral pterygoid, and get inserted to the inner surface of ramus of mandible. Similarly, lateral pterygoid has two heads, the upper head and the lower head. Upper head comes from the sphenoid bone, the lower head comes from the lateral surface of lateral pterygoid plate. And these fibers, they pass backwards and get inserted to pterygoid fovea along the neck of the mandible, and it also get inserted to the capsule of the temporomandibular joint and the articular disc. And please remember, the articular disc is considered to be the remnant of the tendon of lateral pterygoid muscle. In common, the nerve supply is derived by the various branches of mandibular nerve. Among the actions, all the muscles bring about elevation except lateral pterygoid, which helps in depression. So when medial and lateral pterygoid muscle of both the sides contract simultaneously, it helps in protrusion of the mandible. Whereas when it contracts alternatively, medial and lateral pterygoid of one side contracting followed by the medial and lateral pterygoid muscle of the opposite side, it helps in side to side chewing movements. Among the muscles, the key muscle is the lateral pterygoid because of its relation with the other structures. Upper border, there is relation of the deep temporal nerve in the mesenteric nerve. Along the lower border, you see the lingual nerve, inferior alveolar nerve, and the middle meningeal artery. In between the two heads, you can see the passage of the buccal nerve as well as the course of the maxillary artery. So these are some of the points that you can remember for answering certain questions from this topic of muscles of mastication. Thank you.